Welcome, and thank you for joining us today for part 4 of our Hot Topics in Employment Law for Massachusetts Healthcare Organizations series. This installment of the series will focus on labor relations in healthcare. All participants are in listen-only mode. You are encouraged to submit questions throughout the program using the Q&A feature on WebEx. However, if your question is not answered during the session, our presenters will follow up with you directly in the coming days. For those of you interested in CLE credit, an attendance verification code will be read during the presentation. Please write this code down. It will not be repeated, and it is required for CLE credit. Copies of the webinar recording and materials will be distributed to attendees following the presentation. At this time, I'd like to turn the program over to Kristen McGurn.
Thanks, Andy. I appreciate that. And thank you all for spending time with us this morning. We try to do these things in sort of small bites. We know how busy you all are. And, we're hopeful that we can provide some perspective and interesting information for you as you contend with your labor management relations in this industry. As Andy said, this is the fourth in a series. Our prior content included pay equity for healthcare employers, other workforce issues, including Title III and accommodations and accessibility issues for healthcare clients, and finally, workplace violence and OSHA considerations. So if you haven't participated in those webinars and would like to receive recordings or the content delivered in those that part of our series, just let one of us know. We'd be happy to share that with you. And if you'd like to stay in touch with us through our Healthcare Beat podcast, which our healthcare group runs and periodically offers content in the Helpman podcast format, which you can listen to wherever you want, whenever you want. The link to that will be in the chat as we go. But stay tuned for additional content from this healthcare group. We look forward to bringing to you topics of interest that are specific to your industry. And we're, of course, always interested to hear from you what you'd like to hear from us. So if you have suggestions, feel free to post those in the chat or otherwise reach out and get in touch with one of us. But today's content, I'm joined here today by Rob Fisher and Tom Posey, my partners here from Boston and Chicago, LA, respectively, to talk to you about the unique situation that we find ourselves in the healthcare industry with respect to labor relations. And some of that we know comes from just the societal landscape and the polarization generally in our society and in workplaces across the country, and how that has sort of bled into the bargaining table and union organizing activity. We also know how much you all have been affected uniquely by the pandemic and the aftermath of the pandemic, and how that has left our workforces in healthcare strapped and strained and short of talent, and how that has impacted, how we're approaching labor management relations perhaps differently than we have in past years. We also, of course, know, and we'll talk about during this series today, how the administration is approaching labor relations and how even the coverage in the press is getting the attention of union representatives and unionized employees and folks in non-unionized workforces, and how that even UPS's recent contract and the news that and Starbucks and other employers are facing, gets the attention of our workforces and brings issues forward in ways that we haven't seen in recent years. We're also seeing, of course, how the unions themselves are using activity outside the bargaining table and referendums, especially in blue states, to address issues of importance to them, including things like minimum wage in certain jurisdictions, CEO compensation, other issues that are familiar, but now really being trumpeted and a focus of unions as we move forward in this current landscape. So we're going to turn you over to the experts who will talk to you today about what it is like at the table, what we can share with you. It sort of is reminiscent of when in Massachusetts the M&A came from California, kind of using that playbook into our jurisdiction and sort of change the landscape a bit. We see that sort of same theme developing here, and you'll hear from our experts across the country what they're seeing at the bargaining table, how work stoppages and other workforce issues are affecting unionization and the landscape for labor management relations, and how different groups are now coming forward to organize, and we'll talk about that a bit here today as well. We'd like to make this interactive, so feel free to post questions in the chat if we're unable to get to them as we go through. Today, we'll follow up with you for sure after this half hour ends. But with that, I will turn this over to Tom Posey, who'll get us started.
All right, thanks, Kristen. So we're going to start off talking about labor negotiations in the industry in general. If we can go to the next slide, please. And there's 3 different areas that we're going to break this down into to hopefully help everybody understand kind of how we've gotten to where we are right now, where things stand, and give you some guidance on hopefully moving forward in the best way so that when you're at the table, you're as prepared as you can be, or if you're already there, you can potentially adjust your approach a little bit if you need to. Now, the first piece here, how the bargaining landscape has changed since March 12th of 2020, and that's the specific date I had in my calendar as the last time I was in my office before being told you cannot come back tomorrow, we're closing down because there's some sort of flu or something going around. Now, on this piece, while everybody here has probably been on a whole lot of webinars, presentations about what happened with the pandemic, what's the impact of the pandemic. But this one is an important one here. This is a different probably than the kind of things you've talked about before, because there's 2 real important changes that happened over the course of this 3.5 year period. The first is that there were quite a few labor contracts that expired sometime between the start of the pandemic and the present. Quite a few of those, which wouldn't have otherwise been, were extended rather than starting bargaining again. So I'm sure a lot of you, even on this webinar this morning, had contracts that expired maybe in 2021 or even in 22, that the union or the hospital or both said, you know what, we can't even get in the same room to bargain over this right now. Let's just postpone these negotiations, extend the contract for another year or 2. There's also been a lot that's happened at the NLRB in between the start of the pandemic and the present that's is still having a lot of impact on employers at the bargaining table. So let's start by talking about that piece a little bit. Can we go to the next slide, please? All right, so the changes at the NLRB here, in the healthcare industry, most of the impact that we're seeing is because of the General Counsel's agenda and directives. There's a new, or I guess relatively new now, General Counsel at the NLRB, who came in with an extremely aggressive agenda. And what she's essentially done is come in and said, all right, here's what the law looks like now, here's what the rules are, here's what the parameters are for employers. And a lot of those, I think those should change. So my agenda is going to be to change a number of those things. Now that's an agenda coming right down from the White House, from the president when he came in, made it very clear that he's wanting to be the most pro-labor president in history, and so far is working hard to earn that title. But the importance here of those GC memos and her agenda is that that's impacted the way the NLRB regional offices handle charges, claims being brought before them all over the country. So what we're seeing now is a lot of charges where a union or an individual, but usually a union, is filing a charge on behalf of some of the bargaining unit employees, and it is often filing a charge that really says the employer is doing the following unlawful activities. But when you look at it closely, the quote unquote unlawful activities are things that the General Counsel is saying, I'd like to see these change. So really what you've got, which we didn't have much of at all in I'd say the 10 or 15 years preceding the pandemic, are claims being filed that essentially say, you're not complying with what we think the law should be in the future. Now that's already having an impact, starting to shape the way some of the regional offices around the country handle these charges, whether they let them go forward, what they're asking for in the investigations, whether things that maybe 10 years ago would have just been dismissed pretty early as, well, this isn't the current state of the law, are getting a lot further, because what's coming down from the top within the NLRB is instruction that if you get any of these kind of cases, we want to take those forward. We want to accept those arguments. And so there's a lot more of that than we've seen maybe ever before. On the decisions piece, so far we're not really seeing anything that's hugely significant for healthcare employers specifically. There's certainly some that have come out that have more general application to employers across the board, at least as far as some of the actual organizing some of the way that you are allowed to act at the table during bargaining. Some of these are more larger scale issues, things like confidentiality agreements and others that, while they may impact you, or specifically looking at negotiations in the industry, the biggest thing you're going to need to pay attention to and be aware of is those general counsel directives and that agenda. Now, what's also happened as a result of the pandemic is a change in the strategies and tactics that we're seeing from the unions in negotiations. Now, one of the biggest ones, which you're going to hear more from Rob about later, is strike activity. There's, for a number of healthcare employers who have never seen a strike before, or have only seen maybe very brief strikes, a 2-hour action that happens during bargaining to try and shake things up a little bit, are seeing longer, more extended strikes and more participation from employees than they've ever seen before. And the unions have been able to use the pandemic and all the pressure that put on employees, all the feeling that left them with, that they're behind, that there's something that they've maybe lost during the pandemic, that there's things to be gained back now that we've come out of it. There's a lot more buy-in from employees when they're asked to go on strike in the first place. Another that we've seen in a number of industries, including healthcare in particular, is use of referendums and more governmental assistance, essentially, to move the union agendas along. So you may have, whether it's a state or a city or a county level ordinance or a referendum is passed, there's these kind of political directives are coming through where the unions are using the leverage they have there with some of those political action committees and with particular elected officials or appointed officials to put those through. So there's a lot more coming from that area than we've seen certainly in the 10 to 15 years before the pandemic. We can go to the next slide, please. So let's talk about what that means in practical terms. What's actually happening at the bargaining table as a result of some of these more global changes that we've just talked about? Well, the first is the types of proposals that are being made. One of the biggest things we're seeing as for economic proposals is pandemic-related incentives that were put in place as emergency activities, as emergency responses. There's proposals to solidify those, to make those permanent. We've seen this across the state and really across the country in a number of the negotiations we've had going on over the last 18 months or so, where the union's initial economic proposals, one of the things that a lot of employers have been surprised to see is that the union comes in and says, well, all these emergency measures you had in place, we think those should all become permanent. And those, by the way, should be the floor for our negotiations going forward. Though we're not saying let's come up to those. We're saying you already gave us those a couple of years ago in connection with the pandemic. Let's make those the new floor and let's keep them. Put those in the collective bargaining agreement, even if right now they're just a side letter or some other MOA or MOU that was entered into with the union during the pandemic. There's a lot of leverage to do that as well, because employees who, for in some cases, a couple years or longer, have gotten certain incentives, whether it's just for showing up to work because there's been so many staffing issues, or higher amounts of pay to entice them to come in, and also for recruiting purposes. They're saying, okay, sure, the pandemic's over, but I'm not willing to give that back. So of course I should keep what I've already had these last couple of years and go up from that point. That in general is being driven by the bargaining stance that the unions are taking. There's always posturing at the bargaining table. Either side can come in with, well, we're very dug in, we're very strong on this position. But quite a bit now, we're seeing the unions coming in and sticking to a much stronger position, either having or assuming they have enough leverage with the bargaining unit to reject employer proposals that maybe they otherwise would have been inclined to take, or to, in response to a counter proposal, just to move down a hair as opposed to coming closer to meeting us in the middle and just really inching along through the process, even if that's going to make negotiations take longer, which again, from the union's new perspective on this, they're saying, okay, well, that's really a concern for the hospital, not for us if this takes too long, because we're absolutely willing to go on strike if we need to get you to move further than you have on your proposal. Those between the pandemic related incentives that are in place that some hospitals want to pull back now, as well as all the staffing issues that have always been there, but were certainly exacerbated by the pandemic, that's really emboldened the unions in their positions to be much more dug in on these. There's also, as everyone here is unfortunately aware of, more demonstrations, public and media actions, as Kristen alluded to earlier, where we've got a lot more we're seeing on the SEIU healthcare different social media sites. There's very specific and very up-to-date information going on there, posts about negotiations going on, oftentimes at the national, focusing on local negotiations. So again, where in the past, maybe you only would have had the local SEIU Facebook page may have had some post about bargaining or about a informational picketing that the local hospital was going to do. You'll see that on the national, and you're getting more support for that. And they're connecting that with other media sites as well to get more coverage. The other thing that's been a big change for what happens at the bargaining table is the coordination by the union locals with the regional and national offices. So again, SEIU healthcare is probably the best example of this. What they've done over the course of the last 2 years is almost a carbon copy of what we've seen in the 10 to 15 years before this in the hospitality industry. It's something we didn't really see as much from in healthcare, certainly not from SEIU healthcare, where they're coordinating extremely well internally so that the messages from the national with whatever mandates they have coming down that they want the locals to pursue certain things, the locals are communicating through and between the national to make sure that they're all putting out proposals that are coordinated with each other. So the most extreme example of this is where we're in negotiations at a hospital in one state. We've got a proposal that's really been a sticking point, one that the hospital really didn't think was something that was going to be pushed for, or was maybe almost a throwaway proposal from the union. Well, it turned out after we got further along in the negotiations that because this is a larger healthcare employer, that this particular proposal, the main reason the union was dug in is because the employer was refusing to move during negotiations on the other coast. So this had never happened for this particular employer before, where they said, well, wait a minute, here in California negotiations, we're not going to drop this proposal off the table until you change the stance you've taken in your upstate New York negotiations. Now, that's one that certainly it's happened in the past, but not with the frequency that it's been happening over the course of this last year. Go to the next slide, please. So what do you do with all this information? Do you just have to cross your arms and get ready to dive in, or hope you can take the hits when you go in there? We don't think you do. There's things you can do both to help be well prepared for the negotiations, and also if you're already at the table and just getting up to speed or catching up with some of this now, that you can potentially make some moves there. Some of the preparing for negotiations piece is going to sound a little bit common sense, but it's much more important, maybe more critical now than it's been in the last 2 decades to do some of these things. The first one is just knowing everything about your current economics. in 2 separate negotiations over the course of the last year, we had a situation where line level managers were putting incentives in place that upper management was not even aware of. So in 2 separate states, we're at the table and the union says, all right, we're proposing to keep this proposal that relates to, late shifts on Tuesday. Well, what are you talking about? We don't have any incentive for that. Well, it turns out, sure you do, because one of the nursing supervisors, Tom, has been giving these out for the last year and a half, and nobody was even aware it was happening. So as silly as that might sound, you need to make sure you know and understand exactly what incentives you have in place throughout the facility or throughout your facilities if you've got multiples that are under that contract. Another one, which again is going to sound common sense, but it's extremely important, is to review your collective bargaining agreement in detail before you come into those negotiations. There may be clauses in there that you haven't looked at or had a need to look at for years that don't even get touched as you go through the negotiations. You need to take the time to at least go through, refamiliarize yourself with those provisions and identify the ones that you expect to see some sort of proposals on. One of the best examples I can give you on that one is successorship language. Now there's a decent number of agreements out there that don't have any successorship language in them. There's others where it's got maybe just a throwaway line or two. In the event that this hospital is sold or comes under new management, the employer agrees to advise the new owner or manager that this agreement exists. One of the mandates that's come down from SEIU at the national level is that across the country, everybody needs to get in the strongest successorship language they can possibly get. This got us all the way up almost to a strike in some other recent negotiations where even at the facility level, the individual employees in the bargaining unit, we don't think really even cared about this so much. But there was this national directive that everyone around the country needs to get this language in, and this particular local took that very seriously and was really dug in on it. So make sure you know your own contract well and that you're not going to be surprised by some of these things that might be proposed. A couple other quick ones is make sure that you have your strike preparations entirely in order. You should have a strike plan that is very detailed. Here's what's going to happen if we get any activity. There's a number of you have had these plans. Maybe you haven't dusted them off for a while because there hasn't been any activity. Even if you've got a plan that you created 15 years ago, but we haven't had to put too much focus on it because there hasn't been any sincere strike activity or threats of that activity for a long time. Make sure that that's in order. Now, if you're already at the table, that doesn't mean it's too late to do a lot of these things. There's probably 3 things that you can do at the table to put yourself in the best position if you're already in negotiations now. The first one comes back to that strike and activity piece. Make sure you're prepared for demonstrations, even if negotiations are going along well. Unlike what we've seen in a lot of prior negotiations, some of the negotiations now will get to the first, second, third session. Things are going along very amicably. There's no real fires happening, but all of a sudden we get a notice for informational picketing or a one-day strike. Come back surprised by this. What's happening? Thought we had a great first couple sessions to find out, no, we did, but we just want to make sure you understand that we've got enough buy-in to do this and employees are on board. So essentially being prepared for strike activity or picketing activity that's only intended to rattle your cage a little bit and say, look, we've got support for this, so keep that in mind as we're exchanging these proposals with each other. Another one is make sure you, if you're not already, get up to speed on what all the national mandates are. So from SEIU Healthcare in particular, you can spend 15 minutes doing some Google research or connect with one of us and just get an idea of what kind of things are being pushed down from there. The last one is make sure you keep coming back to and highlighting all the positives from the pandemic, because across the board, all of you put in countless incentives, benefit programs, extra help, all kinds of different things for employees during the pandemic both for our benefit and theirs, and we want to make sure that we're highlighting those and getting all the mileage out of those we can at the bargaining table. However, even if we're doing that, we're still at times going to run into problems with those and have pushback from the union, which is probably a good segue into Rob's next section, talking about some of the strike activity that we're seeing and how to respond to that.
Good afternoon, everyone. This is Rob Fisher. I'm a partner in the Boston office. I'm going to begin with is probably the most important piece of information you're going to get from this program, which is the CLE code. So for those of you who are putting in for CLE credit, it is SS2741, S as in Sam, 2741. So as Tom intimated a few minutes ago, the landscape regarding strikes has changed dramatically over the last couple of years. 10, 15 years ago, the conventional wisdom was that unions would threaten a strike at the bargaining table, but they never really were interested in going on strike. It was generally viewed as rare. And in general, even in the absence of a contract, we would see employees continuing to work while bargaining continued. That has completely flipped in the last couple of years. And if you feel like from the news, there's just a lot more labor activity, picketing, strikes going on, you're not alone. It's true. The Bureau of Labor Statistics tracks the number of major work stoppages every year. We don't have the full data for 2023 yet, but as you can see on the slide, in 2022, there were 23, what the BLS terms major work stoppages, meaning it lasted more than 15 days. And in fact, we've had strikes that have lasted weeks and months. And in 2022, which accounted for about 120,000 employees on strike. This year, the BLS has tracked 20 work stoppages so far. And what I think is interesting, 4 of those, so 4 out of 20 are all involving healthcare institutions. And if strikes were rare generally 15 years ago in the healthcare setting, it was really rare that typically you would see what Tom described, which would be a couple of hour strike or a day or two, and that was it. We've now seen a 300-day strike at a Massachusetts healthcare institution. So this is the reality. And so to Tom's point about dusting off your strike plan, the unions, I think, have recognized that the strike is a legitimate weapon, and that for a number of reasons, and I think part of this is what Kristen said, that it's the social and political climate, that there's a recognition that they shouldn't be afraid to go on strike. Next slide, please. I would be remiss in not sort of talking about what makes strikes in the healthcare setting different, and that is that Congress recognized, unlike in other industry, that hospitals need notice to protect patient care. So Section 8G of the NLRA specifically requires unions to give notice of at least 10 days before instituting a strike. Couple of things I want to say about that. One is that, well, there are a number of exceptions to this rule that I think all of you want to be aware of. So first off, the obligation only applies to unions. It doesn't actually apply to employees. So if the employees choose to walk off the job in the absence of a union coordinating it, they don't have to give notice. So 8G only applies to the union. Second, and for those of you who are not in healthcare directly, but provide services to healthcare, the notice doesn't apply to your employees represented by a union when you're doing work at a hospital. So for example, if you're in the construction industry and you've got employees working at a hospital site, a union representing your employees does not have to give notice in that circumstance. Now, there are all sorts of different rules when a union tries to bring a picket line and a strike to a facility where other employees have to be working. We can't cover it here in the time we have, but the point is only that the rule has a lot of exceptions. And then lastly, the board has taken the position in the past that strikes over alleged unfair labor practices by the employer are not subject to the 10 days notice. So the thing I worry about in this context is you've got an activist board, which is now looking carefully at expanding what is protected under the act. You've got a general counsel who is pushing for changes in the law. And so that incentivizes unions to say you're engaging in unfair labor practice, and then 8G doesn't apply. The other area that I think is concerning, next slide, please, Andy, is in the issue of intermittent strikes. And specifically, an intermittent strike is when the union plans to have the employees walk off the job, go back on the job, walk off the job in a way that it's impossible for the employer to know exactly when it is its employees are going to be on strike and when they're going to be working. The board historically has made clear that that is not a protected strike, meaning that employees who do that can be disciplined and even terminated. The general counsel, and this is one of those areas where she's telling the regions, I want to change the law. She wants to narrow the scope of that rule such that it gives unions a lot more flexibility in terms of when it is they can do something like that, where as an employer, you're left wondering, okay, do I need to have contingent staffing today because my workers are going to walk off the job? This is one of those things you want to stay tuned on. It's an issue that general counsel is focused on. And the challenge, I think, for healthcare institutions in particular, and depending on how the board treats the AG requirement, is that you could essentially be whipsawed, where you're constantly trying to bring in replacement workers, temporary replacement workers in the event of a strike, but not really knowing what's going to happen. I know we're pretty close to time, so I'm just going to briefly cover one other issue, which is medical residents and interns. So technically, this is not a new issue, but politically, the NLRB is a political agency, and depending on the party in power and holding a majority of the seats, has sort of gone back and forth about whether or not medical residents, fellows, and interns are employees with the right to organize, or are essentially primarily in an educational relationship with a hospital such that it would be inappropriate for them to bargain. This is similar to issues that we've seen with graduate students who do teaching assistantships and research assistantships. The law currently, as it stands, is that medical residents and interns have the right to organize. So the last decision on this was a decision by what was the Clinton board in 1999 that it was actually involving Boston Medical Center, that they had their employees that could organize. The issue was largely dormant during what I would call the Trump board, so up until the current board. And the reason why is the unions are making a concerted effort not to bring organizing petitions for these groups, and they, just as they weren't bringing organizing petitions for graduate students. They did not want the Republican majority of the Trump board to revisit these issues and decide that, in fact, the law should flip again, and that medical residents, fellows, interns were really in an employment relationship and not an employment relationship. We're now under the Biden board, and so what we're now seeing, not surprisingly, is an uptick in organizing petitions involving medical residents and interns. So again, it's not really new, but the reality is we've now seen a handful of them over the last few months. I think we're going to see more of them. So for those of you who are at institutions where your medical residents and interns have not yet been unionized, this is something to be on the watch for. We are sort of at time, so I'm going to end there, and just so we have a chance to ask questions, or answer any questions that people may have.
So we just invite you to enter a question in the chat if you have any, and otherwise, if you want to go off mute, you can we can work that out as well. But if there are no questions now, we would just invite you to feel free to reach out to any one of us and pose a question about any of the topics that we've covered here today, if that's a more comfortable setting in which to get your questions answered. But we very much appreciate your willingness to spend some time with us during your lunch hour today, and we look forward to hopefully seeing you in another portion of our healthcare series on workforce issues. I see one question coming through. How have bargaining units been organized with residents when they rotate to various sites? Rob or Tom, you want to pick that one up? It's a great question. Thank you, Kendra.
Yeah, so the easy answer is the board, the region so far that the board hasn't addressed this, is they're largely looking at where where they actually have the relationship with. So if it's putting aside where they're being assigned, it's question where their relationship is, that's dictating it. And the regions are largely overlooking the question of, are they primarily spending their time at locations other than the academic institution? This really gets into the larger discussion about how the board is addressing bargaining units generally. And to put it bluntly, the regions are overlooking those kinds of issues and certifying units that regardless of where they physically might be and where the rotations may go.
All right, well, big thanks to Tom and Rob for joining us today, and Andy for kicking us off, and thanks to all of you for being with us. Again, this will be recorded. A copy of the slides and the recording after this event. And again, if you've got further questions, don't hesitate to reach back out. Otherwise, we look forward to seeing you on a future series, and we hope you have a great rest of the day and week. Take care, everyone.